Hello everyone. Hope you are all doing well and staying safe. Today I'm going to talk about myths related to counseling as they are interfering with the help-seeking behavior of people related to COVID-19. As we all know, this COVID-19 is creating many anxieties, fears, phobias, but people are resisting to seek help from a counselor or a clinical psychologist as they fear about the myths which are very famous. And today, so I am going to talk about that myths which have no reality in them. It's just myths. The first myth is that only mental patients go to clinical psychologist or counselor for counseling. This is not at all true, because we all deal with difficulties in life. Life is not constant, it keeps on changing. So we go through different stages of emotions in our everyday life. We have problems in dealing with our own self, our relationship, our job, our friends, our family. We can have minor problems like decision making, confidence problem. So sometimes we only need just a little bit of support. Sometimes we need a little bit of motivation, and sometimes we do need proper sessions for assessment and management of all these problems which we are going through, so we can deal with our life more in a more appropriate and a better way, so we can succeed and be happy and content with our lives. Second myth is whoever go for counseling will be diagnosed as mental patient or will be stigmatized by the clinical psychologist. Again, it's just a myth with no reality in it, as the most important thing for clinical psychologists is confidentiality, and they will never, a good clinical psychologist or counselor never breach confidentiality until and unless there are certain situations where it could be breached, like the individual is in danger or his family members are in danger. It's an order from the court or from the police or from any other mental health professional. So you don't need to worry about being stigmatized as a mental patient. And a good clinical psychologist or a professional clinical psychologist don't focus on labeling you, don't focus on diagnosing you. Instead, the clinical psychologist or the counselor focuses on finding a management plan for you. Third myth is regarding the clinical psychologist or counselor. Many people think if they are very expert in counseling, then why do they have problems in their life? Yes, this is a myth again. But yes, clinical psychologists or counselor do sometimes need help. Even they can go or they go for counseling when they feel that they couldn't solve any problem or they are going in a certain emotional state, because clinical psychologists and counselor are human beings too, and they have same life as anyone else can. They go through emotional stage too, so even they need counseling, but that doesn't mean that they can't deal with their clients, because a professional clinical psychologist or a counselor can separate their life from their client's life. The fourth myth is that a counselor can read your mind or predict the future, which is again a myth and it has no reality in it. because psychologist knows only to that extent how much you tell them about that, about your behavior, about your life, about your situations and circumstances. But yes, they can predict what is going to happen next by knowing the history of your behavior and the patterns you follow. So they can, because they are keen observer and they solve the mysteries from your histories, they can predict the future. But to an extent, how much you tell them or how much you inform them. They don't have any superpowers, so they can go in your mind or read your mind. There's nothing like this. Fifth myth is regarding counselors or clinical psychologists, that they just talk or give advice. Again, it's a myth. So there is no reality in it. Clinical psychologists don't just talk or give you advice. Instead, they assess the problem the individual is facing in the circumstances, and they use different therapies to make a management plan for the individual according to its need, according to his or her needs, so that he could come out of that problem. And there is no advice. Instead, they lead you, they show you different options and ways you can deal with, and you have to make your own choice of getting out of that problem. Now, I hope these myths have made your mind a little bit clear about counseling and the role of clinical psychologist. So you can feel free to contact or consult a clinical psychologist or counselor if you are facing any problem related to anxiety, depression, fear, or coronavirus, or any other problem. Counselors don't just help you dealing with these problems. Instead, they help you in your self-growth, in your exploring your own self, in developing your own self. So keep learning, keep growing, keep developing. Take care. Thank you.